Hello, my name is Dr. Gertie Chimeka Anyanwoke. I am a physician practicing in Louisiana, USA. Today, we're going to be talking about some tips on what do we need to know about colon cancer. The colon is the lower part of the human intestine. It is also known as the large intestine. The part of the colon that connects to the anus is called the rectum. Colon cancer or colorectal cancer is when cancer occurs in the colon or rectum. Colorectal cancer is the third most common cancer in both men and women in the United States. On the global front, it is the second most commonly diagnosed cancer in women and the third in men. However, the incidence in each country may differ. It can affect any ethnic or racial group. In some studies, it has been shown to be the second or third highest cause of cancer deaths in the United States. They usually begin from the formation of some abnormal growths in the colon called precancerous polyps. These abnormal growths can stay in the intestine for years and eventually may become cancerous. So, what are the symptoms of colon cancer? Number 1, early on, there may be no symptoms at all. Number 2, the patient may present with abdominal pain. Number 3, there may be unintentional weight loss. And number 4, there may be blood in the stool. Please note that these same symptoms may be caused by other diseases and you need to see your doctor if you notice any of these symptoms. Now, let us discuss about the risk factors for colon cancer. The first risk factor would be the age. It is common in people above 50 years of age. The risk increases as we get older. In fact, 90% of colorectal cancer occurs in this age group. However, it can occur in younger people too. The second risk factor will be family history of colorectal polyps or colorectal cancer. Number 3, genetic syndromes like Lynch syndrome, which is also known as hereditary non-polyposis colorectal cancer, or familial adenomatous polyposis, also known as FAP. The fourth risk factor will be inflammatory bowel diseases such as ulcerative colitis or Crohn's disease. The fifth risk factor is our lifestyle choices. Yes, this one we can do something about. A, diet, especially when it is high in processed food and meat. 2, when we have high fat in our diet. 3, when we have low fiber in our diet. And 4, when we have low amount of vegetables and fruits in our diet. B, smoking and tobacco use. C, alcohol use. D, lack of regular exercise and or physical activity. And E, being overweight and obese. Now that we know the risk factors, how can we reduce our risks? Number 1, colon cancer screening for people between the ages of 50 to 75 years old. The frequency after that will depend on the findings. People with family history of early colon cancer should discuss their age of screening with their doctors. Sometimes in persons with symptoms, they may get the diagnostic test. The other way to reduce our risk is by decreasing the above risk factors. For further information, please discuss your specific risk with your doctor, or you can WhatsApp us at 225-588-6046. Again, I am Dr. Gertie Chimeka Anyanwoke, physician practicing in Louisiana, USA.